meeting to order. There's a card here on my desk which says, among other things, no one should be in your meeting other than committee members, your committee assistant, and any guest you may have invited. So to all of you who are here, you're all my guests, you're all invited. Take care of that card. I'll ask the secretary to call the roll.
Ryan, Parker, Burnett, Blackman, Blunt, Blackwell, Kaufman, DeBar, Billigane, Frazier, Harkins, Hobson, Horn, McMahon, Parks, Polk, Tate, Wiggins. We have a quorum.
I don't see Senator Barnett. So we'll pass that and go to item 2731. This is a bill which gives the Department of Human Services more authority to use the computers and reporting systems that they wish to use in administering various programs, including food stamps, AFDC, and on and on. It's an agency bill. Are there questions on the bill? If not, is there a motion? The motion title sufficient to pass. We ready to vote? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Is Senator, oh, there's Senator Boyd. Hello, Senator Boyd. You two are my guest. We'll go to Senate Bill 2899, which is a bill by Senator Boyd. He's been nice enough to come and correct me if I get this wrong. Community mental health centers are licensed through the State Department of Mental Health. So their licenses do not come about the same way that licenses do for some other entities. As a result of that, they are not eligible for reimbursement under the rules that some insurance companies have. What this bill would do was say that for purposes of reimbursement, insurance companies, their licenses are just as good as anyone else's licenses. And the real world effect of this is community mental health centers operate with revenue from a bunch of different places. Here, yonder, there, everywhere they can get it. They take Medicaid, Medicare, whatever. And there are people who have private insurance who go to community mental health centers and the private insurance pays. There is a subset of those with private insurance who get services, but their insurance won't pay for them because of this quirk. And the real world consequence of this is it would get more money to the community mental health centers for services they are providing. Senator Boyd is nodding. So I guess I got that right. Are there questions? If not, are you ready to vote? Is there a motion? There's a motion title sufficient to pass on Senate Bill 2899. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2900, newborn screening. Senator Johnson.
Thank you, Mr. Chairman. Senate Bill 2900 deals with newborn screening. Currently, our law references the American Academy of Pediatricians, pediatrics, to set the diseases that we screen for. And that's been changed now. The people who set those are, as the recommended uniform screening panel, or RUSP. So we're bringing our code up to date with that and putting in that we will bring new screening current with what they recommend within 2 years of the recommendation. That's an explanation of what's with us.
Senator Johnson moves title sufficient to pass. Is there debate? Are there questions? Are you ready to vote? All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2729, single or loose cigarettes prohibit sale of. Senator Barnett.
Thank you, Mr. Chairman. This bill is a result of not only me observing, but talking to others in the convenience store industry, is that there's a lot of convenience stores out there that's really not part of the Association of Convenience Stores that do sell single or loose cigarettes to individuals who may come in and buy it. And I know this committee may ask, why are we talking about just cigarettes? But what I do understand is that cigarettes in a lot of these places is a big economic driver. And these people that sell these loose cigarettes, not only do they sell the loose cigarettes, but they also sell to minors. And if you notice, a lot of these places or a lot of the convenience stores where we have a lot of other unlawful activities going on, and there's a lot of crime that happens in and around these areas. And that's why I'm asking this committee to support this bill so that those people will not be able to sell tobacco products for 6 months, not the individual, but the facility. Because what we've also noticed is that if you find the individual, then tomorrow it's opened up in that individual's brother or first cousin's name, and they're doing the same thing. So this is an opportunity to not only punish the individual selling, but to stop the sale of tobacco at this particular facility for 6 months. And I have, like I said, I've spoken with the Convenience Store Owners Association, and they agree that there's a lot of these places that does this, and needs to be some type of action taken to prevent this from happening.
Senator Harkins.
Explain the reason for whether you're a member or not of a convenience store association. What does that have to do with anything?
It really has nothing to do with why we're trying to do this, but I did speak to them in regards to this convenience store chain as a whole, in regards to this.
Okay. I thought I heard you say that there are stores that are not members of the Convenience Store Association that are selling cigarettes. And I just didn't understand what was the reason. Why does it matter if they're a member or not? Is it against the law to sell cigarettes if you're not a member of the?
It's not at all. This, like I said, this was not a decision made by them. And this is not to sell the cigarettes, but these are individuals who open a pack of cigarettes and they only sell 1 or 2 or 3 cigarettes out of that pack, which is illegal. And not only are they doing that, but they're also selling tobacco products to minors and everyone else, because they're just concerned about what's being sold and they don't care who buys it or anything.
So current law, you're not allowed to sell single cigarettes.
Exactly.
And they're doing it in stores right now.
Yes.
Whose purview is to regulate that?
It should be left out, I guess, to the ATL. I guess. Maybe alcohol, tobacco, and
That's a federal.
or it may be Department of Revenue that should be
Yeah.
monitoring this.
Okay. Thank you, Mr. Chairman.
Senator Phillingain.
Thank you, Mr. Chairman. So the question I had is, if they're already breaking the law in many of these instances and selling to minors. Is that what you're saying? Okay, so why would, if they're already lawbreakers, by changing this law, why are they going to start abiding by the law and keeping this law when they're already breaking another law? I don't understand what you're trying to accomplish.
Well, what we're trying to accomplish is that we noticed that if you stop the sale of tobacco, if they are prohibited from selling tobacco, then it also, we're hoping that it slows them down from doing other illegal things at their stores as well, because it's not just tobacco that they're selling to minors, but these are stores that also will allow individuals to come in and purchase goods with EBT cards that's not really things that should be bought with EBT cards. So, but we think if we could slow them down with the tobacco and not just, like I said, not just punish them with a fine, but to stop the sale of tobacco products for 6 months at that particular location.
So why not then just ban the sale of tobacco at these locations, period? I mean, if that's what you're trying to accomplish.
If you want to offer that as amendment, I could take that. But I was just, if it's, again, it's the location, it's to find the individual and the location.
Gotcha. Thanks.
Further debate, questions? Senator Wiggins.
Senator Barnett, is it my understanding that it's not currently prohibited to sell single or loose cigarettes?
It is against state law to sell single or loose cigarettes.
So, okay, if it's already against state law, why are we, line 43, why are we prohibiting it again? I'm looking at line 43.
I'm also looking at line 43. And I think this is just further explaining that unless the commissioner authorizes these individuals by by giving away a pack or two or something like that with it, I think that's what this is basically saying.
Okay, does the commissioner already prohibit loose sale of loose cigarettes? Or is it a function of state law? Or do we know?
I think it's a function of state law.
Well, I guess that begs the question, why are we doing it again? The way
Well,
this-
it has in here the commissioner, so it may be the commissioner instead of the state law.
Well, I guess I'm putting on a little bit of a lawyer hat here. I think it's already, it's not prohibited, and thus the language in line 41 and 40 through 43 is thereby prohibiting loose sale of loose cigarettes.
From what I was told, Senator, that when I asked the question about the sale of cigarettes, I was told that it was not legal to open a pack of cigarettes and sell them individually out of a pack of cigarettes. One or two or three out of a pack that's already been packaged for sale.
But the sale of single cigarettes is happening.
Yes,
Okay, so then does that mean law enforcement is responsible for enforcing the law?
should be, yes, but what we're asking for is that there'll be some stiffer penalties other than just the fines and stuff, because we realize again that a lot of these places that this is happening are allowing other illegal activities to happen as well.
Okay, so I'm sorry to keep going, but if you look at lines 45, where it dictates that the commissioner shall revoke the permit to sell, that's not currently law, is it?
No,
Okay, so if they're selling loose cigarettes, then, and it's determined that they're doing that, the commissioner can revoke their permit to sell tobacco.
yes.
Is that what? Okay. Okay, thank you, Mr. Chairman.
Anyone else? Further debate? Are you ready to vote? Senator Barnett moves title sufficient to pass. All in favor, say aye. Aye. All opposed, no. It appears the ayes have it. Here's the ayes have it. The ayes have it. We'll report that to the full Senate. We will meet tomorrow at 3 p.m. For a hearing on the nurse practitioner issue. Remember a couple of months ago, we had a hearing and basically ran out of time. And so we will, to some extent, pick up where we left off a couple of months ago. We will hear from the Medical Association and the opponents of the proposition first, and then we'll hear from those who are supporting the nurse practitioner legislation. We will not be voting on that bill tomorrow. I do not anticipate that we'll be voting on anything tomorrow, although possibly things can change. The committee deadline is Tuesday. We have a regularly scheduled committee meeting on Tuesday, and I wouldn't put it past the chairman to call a committee meeting on Monday also. But that's sort of where all of that stands. I would encourage you all to attend the hearing tomorrow. Same bat time, same bat channel. Motion to rise and report. All in favor say aye. Opposed, no. Ayes appear to have it. Ayes have it. It's my